Okay, welcome everyone, and thank you for joining us today. My name is Jennifer Quinlan, and I'm the Member Services and Recruitment Coordinator for JP at Home. So we're delighted to have Sue Tina here today, Ethos Director of Home Care, Daniel Doherty, and Carolyn Walsh, our Geriatric Care Managers. All of them are available to you and an important part of your village. Bree Santos is also here today, helping with the technical issues. Hopefully no technical issues, but he's helping assist me today. So a couple of housekeeping things before we get started. What happens if we do run into a technical issue along the way? Simply log off from your screen and then log back in. If for some reason this doesn't resolve the issue, please note that we'll be recording this presentation and we'll have it available for another time. So we're happy to take your questions today. We invite you to chat your questions at any point during the session. We'll address the questions at the conclusion of the presentation. I'm going to share my screen. So why are we gathered here today? We want to make sure that you're aware and able to tap into all the resources and professionals that are available to you through your membership. Today, we're going to help you better understand the state home care system and private geriatric care management. The call to action today is to sign up for virtual needs assessment. I know some of you on the webinar today have already had an assessment and found it to be very beneficial. I think in Massachusetts, we're really happy and really fortunate to have high quality elder services. And I think JP Home, with JP Home, you have a system to help you navigate those options. And I'm here, and Daniel and Carolyn and Sue, we're all here to help you navigate the system. So again, we invite you to chat your questions at any point during the session. We will address the questions at the conclusion of the presentation. So let's get started. I'm going to just invite you to read the slide, and then I'll go over it with you as well in just a minute. So all full and household members are eligible for a virtual needs and safety assessment over the platform that you choose, whether it's Zoom or FaceTime. Members may also purchase services directly from Ethos vendors at rates that are significantly lower than the open market. Members do not need to meet eligibility requirements to access these discounted services other than being current on your membership fees. Alternatively, members can seek a referral to the state home care system, and Sue will be speaking about that in a few minutes. Members may also work with Carolyn or Daniel, and they're important potential members of your care team. So here you see a brief comparison of your options. Members have gone all different routes depending on their preference and their unique situation, their level of need, their financial picture. At times, members have used a combination of these services, for example, state home care, along with your private geriatric care management. You also can use the state home care system along with purchasing additional services through Ethos vendors. You can receive your home care services through the agency that serves your catchment area, and that may be Ethos, Central Boston Elder Services, or Springwell for members who reside in Brookline. So the copay varies depending on your income. It includes free case management, and the care advisor can work with you to revise your care plan as needed. So any member can also connect directly with Ethos vendors for as little as 1 or 2 hours a week. It's consumer directed care and a little bit more flexible than the state system because you're not limited in the number of hours that you receive. Members work directly with the vendor, and I found it's been very helpful when a member has a short-term need. For example, some members have contacted me when they have a planned surgery, knowing that they would have a temporary need such as laundry or meal preparation. So this care can be set up rather quickly without a lengthy assessment. So you may seek private care management when you find yourself or your spouse are requiring a higher level of need, and when you are able to afford that extra care and attention. So please note that I'm always available by phone to kind of go through these options with you if you have any questions. So I just want to reiterate that I'm really happy that you came today, because I think it really means that you're being proactive about your care. I'd like to emphasize the importance of accessing the needs assessment sooner rather than later, because it helps both you and Ethos become more prepared to meet your needs in the future. So when we're aware of your living situation and your support system, we can potentially help prevent some challenges down the road. So the virtual assessment, it's an informal conversation. In that hour-long meeting, we can learn a lot about you and your needs. After the visit, you'll receive a summary report of all the referrals and recommendations we're making. You can kind of think of it as a roadmap for your future planning. So I guess while we wish we could meet you in person during this time of physical distancing, this still is a really good opportunity to meet with us and set up an appointment. It's actually pretty convenient right now for us to schedule appointments. So we hope that you'll take us up on that. So both Dino and Carolyn are available to support you for further consultation anytime after that initial home visit. So now I'd like to introduce you to Sutina. Sorry. Okay. Thanks. So Sue is a social worker whose area of practice is with the older adult population. Sue obtained her MSW at Salem State University and is a licensed social worker. Sue has been in Ethos since 2003, holding various roles with the home care program prior to becoming director in 2018. So welcome, Sue, and thank you so much for joining us.
Thank you, Jennifer. I'm really happy to be here. As Jennifer said, I'm the director of the home care program here at Ethos, and I'm always happy to talk about home care. As she said, I've been here at Ethos since 2003. I've grown up here, and so this agency and this program are really important to me. I love the work that I do, and so I'm glad to share that with you. So I'm going to go ahead and try and share my screen with you in just one moment. Okay. Sorry, there we go. All right. So hopefully everyone can see that. I'll make it a little bit bigger in just a second. So hopefully everyone can see that now. If not, someone speak up and let me know. So I'm going to talk, as I said, about home care. Home care is a state-funded program that enables eligible individuals who are 60 or older to remain in their homes as they age. We provide supportive services to help people stay independent and living in their home where they want to be. The only time that we can take someone into our program under the age of 60 is when they have a documented diagnosis of Alzheimer's disease or related dementia. Otherwise, the age eligibility criteria is at least 60 years old. And we provide a wide menu of services. Not every consumer in our program gets the same services. So the services are tailored to the needs of that individual. So although we have a huge range of services, not everyone needs or chooses to receive every one of those services. Some of the most popular ones you see here on the slide. So homemaking, so that's for cleaning, laundry, shopping, and meal preparation, or any combination of those activities. We also have a laundry service. That's a pickup and delivery. Some of our consumers don't have a working washer and dryer in their home, or maybe they live in a building where the laundry room is pretty busy, or for whatever reason, they prefer to send their laundry out, we do have that service as well. We have grocery shopping, so we can either have a homemaker go to the grocery store for our consumers, or we have a grocery delivery service where you can order by phone. So there are many private pay grocery services out there. A lot of them you have to order online. The one that we have, you can order by phone, which is a little bit easier for some of our consumers. We also can assist with activities like bathing and dressing. You'll see here on the slide, Alzheimer's coaching for caregivers. Basically, if you are someone who is providing care to someone with dementia, it doesn't have to be Alzheimer's, it could be any type of dementia. We do have a service where there's usually about 3 sessions. It's education and support for the caregiver and kind of understanding what's going on with the disease and sort of how to strategize to provide good care for the loved one, and also to for the caregiver to get the support that they need at the same time. So some of these services are the most popular ones. Here's a sort of more extensive menu of different services that we offer. I'm not going to necessarily talk about every single one right now, but if people have questions about that, I think we're taking questions at the end, and I'd be happy to talk about any of these. But just to kind of go through some of them, the first one, adaptive housing equipment. So usually this is going to be things like tub seat, transfer seat, grab bars for the bathroom, handheld shower, maybe a cane or a rollator, something like that. So this is equipment to be used in the home, durable equipment, non-disposable, reusable equipment is something that we can provide. Adult day health programs, some of our consumers do go to a day center. At these centers, there are activities, structured activities throughout the day, including social activities, music or art-related activities. There's a nurse and a social worker on site if they need some monitoring or medical support, things like that. Right now, because of the pandemic, the adult day health programs are not open. They're doing some telehealth check-in calls with their consumers at the moment. Alzheimer's coaching, I mentioned. Let's see. Grocery, I mentioned. Home delivered meals, that's another really big one. We cover the entire city of Boston through our meals program. Our home care consumers are able to benefit from that nutrition program here at Ethos, so they can get the home delivered meals. And we have a lot of different options for the meals. The meals are no cost to anybody. You don't have to qualify based on income for meals. And we just ask for a voluntary donation for those. So the meals, there's, Russian, Healthy Heart, Southern, Caribbean, vegetarian. We have diabetic meals, renal meals. We provide Ensure, Glucerna, Lactaid. So there's a lot of different options with the meal delivery service. And the nice thing too about the meal service is it's a safety check as well. So when the driver drops off the meal, they have to make contact, at least visually, or they need to hear at this point during the pandemic. They don't necessarily get close to anyone, but they need to hear or see that the elder is okay. And if that's not the case, if they don't make that contact, they report that back to the agency, and we do a phone call to check in and to confirm that the person is okay. So that safety check is really helpful for a lot of folks. We do have a contract with Sullivan's Pharmacy for medication delivery. So if somebody has a hard time getting out to pick up their prescriptions, one of the services they could get as a home care consumer is the delivery of that service. We homemaking I mentioned, laundry I mentioned. Let's see what else. Personal emergency response system that you may have heard of before. The brand name Lifeline. So you probably have seen the commercials. I've fallen and I can't get up. You know, it's a little button. You wear it around your neck as a pendant or your wrist as a wristwatch. And basically, if you're home alone and have an emergency, can't get to the phone, you press the Lifeline and an operator will respond, check with you to see if things are okay, and if necessary, contact your emergency contact or 911. So that's a really important service for a lot of our consumers, and we encourage most of our consumers to get that, but it's up to them. Transportation is something we provide. So depending on which care program the person is in, that will determine if they're eligible for transportation. Usually our transportation is for medical appointments. In some cases, it can be for other things as well. So those are some of the more popular ones from this menu of services. I'm going to actually skip this slide for a second. I'm going to come back to it in a little bit. So next, I'd like to talk about eligibility. How does one become eligible for this program? So as I mentioned, you have to be at least 60 years or older, or under that age, a diagnosis of dementia. For residency, for the home care program at Ethos, and there are other home care programs all across the state, depending on where the person lives. But the home care program at Ethos serves West Roxbury, Roslindale, Hyde Park, and most of Jamaica Plain and Mattapan. And if you live in a different area of the city or even outside of Boston, we can also connect you with the home care program that serves those areas. So no matter where you are in Massachusetts, there is a home care program like ours that serves your home address. But for our program, you need to live in one of those neighborhoods. Financial eligibility. So technically, there's no income limit for our programs. What is true is that there's a co-payment for services in our program. It can range from 0 to 100% of the cost of service, and that is based on income. So we do need to ask for the consumer's income information so that we can determine if there is a cost for their services and also which level of care they will be enrolled in. There's 6 different programs within the program, and they have different criteria around clinical frailty and income and assets. So within our program, there are differences in terms of those criteria, but the important thing to know is that if you or the person being referred is assessed a copay and that copay is not affordable because of financial stress for whatever reason, maybe a mortgage, maybe medical bills, things like that, we will work with our consumers on that because we are a nonprofit, we're mission driven, and if someone is experiencing financial stress, we will work to make sure that the copayment is not a barrier for their services. The case management. So once you come into this program, you're assigned a case manager. That is your person, your contact here at Ethos that you will call when you need things. That case management is free of charge to all consumers. Nobody pays for that case management service itself. You may be paying something for your services through your copay, but you're not paying for the assistance of the case manager. So I mentioned a moment ago clinical frailty. And so the way that we determine if someone is in physical need of our program, this is for people who do need some help to stay independent at home. If you're able to do all your daily activities, you're not going to qualify right now for our program. But when we are assessing for eligibility, what we're looking at is activities that people do throughout the day. And can they do those activities safely and consistently, independently, without the help of another person? If they do need another person to assist them, then those are the areas in which they may qualify for service. So there's something called activities of daily living, ADLs, and those have to do with the care of the body. So that's things like bathing, dressing, eating, using the toilet, continence management, transferring, which is getting up and down from a chair, in and out of bed, and mobility. So if the person needs physical assistance or even supervision with some of those items, they're likely going to be eligible clinically for our home care program. And then we also have what we call instrumental activities of daily living. And these ones are less directly tied to the care of the body, but they are important activities that we do every day. So this includes things like meal preparation, shopping, laundry, managing money, housework, transportation, using the telephone, ambulation outside, and taking medicine. So these activities, if the person is assessed as needing help in multiple areas, they will likely be eligible for the home care program. So I think that's all I'm going to say about that for now. But again, I can take questions at the end of the presentation, or you're welcome to contact me at any time for more information. So going back to the cost, this is just to give you a sense. So as I said, cost can be anywhere from 0 to 100%. Here's sort of the upper end of the scale for income-wise for our services. So you can see the left side is for an individual who's not married, and then the right side is for a two-person family, which in home care regulation land means married, legally married. So the left side is single individual, the right side is married couple, and you can see the income range. So for example, on the left, if your income is between $28,866 and $31,276, your copay every month for service is 50%. Meaning, whatever services we provide, you pay 50% and we pay 50% for those services. So that's how these services are actually subsidized by the state. You can see, okay, so you're probably wondering at what point does it become 100%? So you can see for an individual, when your income is $52,389 for the year or above, then your copay is 100%. But as I said, if copay is a concern for you, we would not want that to be a barrier to seeking out our services, because we do have the ability to work with people on that. Here's some contact information, but I'm going to go back to that slide I skipped a few moments ago, so just bear with me. Who performs the assessment? So I want to talk a little bit about what happens when you make a referral for services. So basically, anyone can make a referral for services. It can be the elder themselves or a family member, friend, neighbor, doctor, nurse, anybody. The person doesn't have to actually consent to the referral. They will have a chance to consent or decline, but it's after the referral gets made. So to make a referral, somebody will call Boston Elder Info. They take all of our referrals for us and for the whole city of Boston, actually, because there's 2 other home care agencies in Boston. As I said, it's by geographical area. So the neighborhoods that we do not cover are covered by 2 other agencies within Boston. And so we share a hotline. It's called Boston Elder Info. And you just call that line and you make a referral, and they will make sure that the correct agency gets the referral. What happens next is that we look over the referral. We see who it says to contact, whether it's the elder themselves or the referral source or somebody else. We contact that person. We explain who we are and why we're calling. And we offer to do an intake. Now, before the pandemic, this intake would be in person at the home of the elder. Right now, we're doing these intakes by phone. So the intake will be done by a specially trained intake worker or case manager. And basically, we're going to be asking a lot of different things. We're going to be asking for, their emergency contact information. Who are their medical providers? What hospital do they go to? What are their health conditions? We'll interview them about their daily activities, those activities I mentioned before, bathing, dressing, meal prep, cleaning, all that stuff, so that we can understand if they're clinically eligible for the services. We'll interview them about their income, as I mentioned, so that we know which level of care they qualify for and whether they have a copay. And if this was in person, we would be looking at, the condition of the home. Are there any concerns there, like broken steps or the heat isn't working or tripping hazards, things like that. And we'll talk to them. We'll also take down their medications, by the way, as well. And we'll just talk to the elder and the people in their care environment about what they think their needs are and what services they would like to have. We honor self-determination, so it's really up to the elder what they want to receive. If they don't want to receive something, but we're concerned that maybe they need it, we'll be encouraging about it, but ultimately they can say no. So that's where consent comes in, right? Because although they didn't consent to the referral, they can tell us they don't want to have the intake, or they can have the intake and then tell us they don't want to have the services, or they can open their case and then close their case, and that's fine too. We do have nurses here at Ethos who contribute to the assessments in certain situations, depending on which services the elder wants. And then once the case opens with us, then a case manager is assigned, and that case manager typically would do visits. Right now, visits are telephonic, but they would do visits either twice a year or 4 times a year, depending on the level of care, to reassess and make sure that the service plan is appropriate and needs are being met. And then once a year, we do review the income information. So the case manager's role is to be there for you when you call. So if you have questions about your services, or there's a problem with the service, maybe the worker's been late a few times or something like that, or you have the laundry service and your laundry came back pink or something like that. The case manager that is there to problem solve and try and get things straightened out. The case manager can also provide information and referral to direct you to other resources, whether it's fuel assistance or veterans benefits, SNAP, which it used to be called food stamps, things like that. So that person is there to kind of help guide your services and provide you the information that you need. So going back to the contact information, here you'll see the contact information for Ethos, as well as on the left side, Boston Elder Info. That's where you call to make referrals. Age Strong Commission is our area agency on aging. And the Executive Office of Elder Affairs is the part of state government that regulates us and makes sure that we're doing a good job. So I think that will do it for now, unless Jennifer, do you have more questions that you would like me to go over?
Okay, I'm back. Thank you so much, Sue. I think you did a wonderful job explaining everything, and I don't have any additional questions right at this moment. Again, if members want to chat questions, they can do that. Actually, in the Q&A box down there. That was so helpful, and we are really, really fortunate to have someone as knowledgeable as you in this role. So thank you for everything. I'm going to stop sharing your screen.
Thank you.
Actually, go back to my screen. Okay. Just a second. Oh, shoot. Okay, sorry. I'm going to have to go through this again. I'm sorry. Oops, here we go. Okay, so we're on to the private geriatric care management section of this presentation. So a geriatric care manager is usually a licensed nurse or social worker who specializes in geriatrics. They are sort of a professional relative who can help you and your family identify needs and find ways to meet your needs. So Daniel shared this definition once at a presentation, and it really resonated with people. And I like it because I think you may find yourself in a position where you need somebody other than family to help you negotiate some complex situations. So I thought that was helpful. A second. So geriatric care managers can guide and support you through multiple challenges and decisions. They can help you make short and long-term decisions or short and long-term plans. If you require a different living arrangement, they can work with you to identify the most appropriate option. For caregivers, they can provide critical emotional support, and they can connect you to respite services if and when that's needed. So I'm very happy to introduce you to Daniel Doherty today. Just a minute. So Daniel is the founder and director of Care Management Solutions. He is a registered nurse with a degree in healthcare administration. He has more than 25 years experience in healthcare as both a clinician and administrator. He has held leadership roles in the community health centers, and including adult day health. He's been with JP at Home for a few years, and we are very lucky to have him. I'm going to just, hang on a second. Daniel, over to you, Daniel. You ready?
I am ready. I'm just not sure what you want me to talk on at this point. Do you want to talk about geriatric care management or the virtual assessment?
I think both. Both would be great. Okay. So you can start with your background and anything you want to share, kind of why you're in this field, and looking forward to hearing from you.
All right, this will be off the cuff. I wasn't ready to do that part of it, but I know it since I lived it, so I know it. So, yeah, as you said, 25 years in the field, actually longer than that if you include a hospital laundry and a hospital storeroom, which were my first two jobs before I became a clinician and a registered nurse. In terms of the nursing part, I was mostly emergency room and oncology. And then back in 1990, went into administration, and that was when I worked with the VNA. And so I've worked in home care essentially for 20 years as a clinician initially, and then as a director of home care services, and then as the executive director of a certified home care, which is when Medicare or Mass Health pay for it. And then I've also been the CEO, although in our industry, they don't use that term, but they did at this company. I was also the executive director or CEO of a private home care, which is exactly what it sounds like when people have to pay privately for services. So both as a clinician and as an administrator, I have a fair amount of home care experience. And then started my own private practice in terms of geriatric care management 3 years ago, and actually at the very same time, relinked with Ethos and JP at Home as one of your providers, like Carolyn, who we'll meet in a second, in terms of doing the geriatric care management piece. And then in terms of our role as it links to the clients, which is what we're here for, the members of JP at Home, my role, like Carolyn's, is twofold. So the first is to do the virtual, now virtual, but the client assessments that all JP at Home members are eligible for. And I can talk about that in a second. And then the second piece is to do private geriatric care management if a client chooses to purchase that option at a discounted rate. And just to underline from where you had started in the beginning, Jennifer, the important thing I want members to understand is the first piece I'm going to talk about, the initial home assessment or the initial client assessment and at home that we're doing virtually now, that is free. It's part of their membership. So everybody is eligible for that. And then if they have additional services and they want to hire people at a discounted rate, they have the option to do that. So very briefly, in terms of the assessment piece, because you had touched on it, Jennifer, in your introduction, what we do, we all do it a little bit different, but just to punch through 4 or 5 quick things that I focus on in mine, and I think we all do, is we do a brief history of the client. For me, that's about who are they as a person, where are they from, how long have they lived in this area, connection to family, friends, and other type of support. And then I like to do a brief past medical history with a focus on current issues. As many people who have had me do it now, I always say the same shtick. If you had a gallbladder out in 1972, I don't care. And I kid when I say don't care, but what I mean is I want to know today what's going on. Are you having shortness of breath walking up and down the stairs? Have you had a diagnosis of a heart attack in the past? Do you have COPD or diabetes? Those are the things that I want. What affects your life today in terms of the assessment? The third piece for me is any services you currently have, and they don't have to be official or professional or through Ethos and JP at Home. Just what do you have access to at this time? It might be an outpatient therapy. It might be mental health services. It may be a Meals on Wheels or something that's not necessarily associated with Ethos, which probably would be, I guess. But And then the fourth part for me is looking at the services they need in terms of this initial assessment for JP at home. And that, again, is the services through JP at home and Ethos. Is it adult day health? Is it the handyman? Is it Meals on Wheels, as I just mentioned? And then the last piece that we do in the home, and this is probably the only part that's a little funky to do in terms of the virtual piece, is when we're in your home, traditionally in the past, before the pandemic, we do a walkthrough of the home to look at home safety issues and thresholds and CO2 detectors and, excuse me, somebody had mentioned, I think, your home care director about, missing steps or things like that. And so that piece we still can do virtually. We just sort of walk through kind of in a checklist kind of way about are any of these issues for you. And then again, we can recommend either free or discounted services that can help support that home safety evaluation piece if need be. So that's the piece in terms of the virtual assessment, unless you, Jennifer, or somebody has a question, and then I can talk briefly on the GCM, geriatric care management piece if you want.
Yeah, Gina, that was really helpful. I think that's good for now. And if we have more questions, we'll get to them. Thanks so much.
Okay, you're welcome.
Okay. So now we have Carolyn.
Hi there.
Hi there. I will introduce you. So Carolyn bridges her background in education and nursing to provide comprehensive assessment and recommendations for all older adult consumers and their families. Carolyn can help you and your family with both acute needs and managing needs over time. She has an appreciation for each season of life and aims to guide you to experience the very best during your later years. So thank you, Carolyn, and welcome as well.
Thank you. So I'll share my background like Daniel did. And interestingly, Daniel and I both started our practice about the same time, 3 years ago. So my initial professional life was in education. I taught at the college level. And if you can believe it, way back when we were talking about the World Wide Web, and they were talking about all this potential with technology and communication. So I taught with communication theory at the college level for about 15 years, and then dovetailed that into homeschooling my own family for 10. And coming from a medical background, had always had a desire to pursue that. So then went to nursing school and got myself involved clinically and in home care simultaneously for a while. And I loved doing all that. But the reason why I was drawn to geriatric care management really is because as a clinician, and Daniel, you probably experienced the same thing, is that I had these patients and I'm doing the discharge planning and I'm sending them home, and we're working with the social work team and everybody's getting everything in place. And it looks really good. And the second they step beyond that threshold, that's it. We have no control. We have no ability to assist them and to make sure that things are happening in a supportive way. And simultaneously working with home care, recognizing that home care is wonderful and it's a game changer for a lot of people, but it also has its limits. And so as a nurse out in the community, working with private home care, it was very difficult to really advocate on someone's behalf and get the appropriate level of assistance in place, and to get the communication with the medical professionals in place. I didn't have the ability to reach out and speak to the doctor or follow through with the VNA. And so over time, just really developed this passion to be out there and be a real advocate. And that's what I love about what I do now, is that similar, Daniel and I do similar things. We both have different personalities and pursue it similarly but differently with the individuals that we work with. But I can really be an advocate and I can navigate the ins and outs. I like to think about geriatric care management as, if you had a jar and you filled it with stones that represented your primary care doctor, your sister-in-law who takes you to appointments, the home care agency, Meals on Wheels, the support group that you attend. All of those pieces are an individual stone, but they don't all necessarily work together harmoniously. And so geriatric care management can come in, and we're sort of the sand that fills in between all those stones to make it more solid and make it flow and build the bridges between the different levels of support that you may already have in place, and then ensure that you are getting the level of support that you need in order to do the things that you want to be doing in your life, that you can be doing in your life safely. Jennifer, am I going to share any screens here, or?
Yeah, you can share your screen if you want to. So
it helps if it just helps, I think. So this is Daniel and I are both part of a large professional group called the Aging Life Care Association, and I really like how they break down what we do. And it's different. It really is different for every client. But these are mainly the 8 areas that we tend to focus on. Being a nurse, I really hone right in on the medical issues, because I think we've got to sort of figure those out first in order to move on to anything else. But we take a look at up in the upper right, the health and disability, and what issues, like Daniel said, what are your current issues? What's the acuity, and how can we help you make it better, make it more manageable, both short-term and long-term. And then part of what we do too is we have to realistically look at financial resources. Is this individual in a position to bring on other supports that may be a cost to them, or do they need subsidized supports that are in place? And we sort of identify those things, make that happen. And the virtual assessment is wonderful in looking at this next thing, the housing, where we want to make your home the best place, the safest place it can be. And that might mean literally just moving a nightstand out of the way, or it could be as far as saying that somebody isn't necessarily safe staying at home. So finding different solutions to that. Family, identifying who is really helping and supporting, and in what ways are they helping and supporting. So just to give you an example of what I do as a care manager, oftentimes I'm working with people who don't have any level of family support. And so we find other ways to bring that in. But if you do have a really interactive family, sometimes they all want to do the same thing. They all want to take mom or dad or their aunt to the appointment. So they all fight over that. But really somebody needs to take her to the appointment. Somebody needs to bring the trash out every Wednesday night because it's going to be picked up on Thursday. Somebody needs to bring her the Sunday paper. So we figure out, how everybody can be involved and in what ways can they be involved. And sometimes, as people have the complexities of aging, it causes a lot of tension in families because it's unknown. It's the first time they're going through it. And bringing on a care manager is a great idea to help navigate that and really help understand, different ways that people can be of support and help out. Just for an example, I have a family I work with, and they have 4 children. And one of them really doesn't like to be involved, but he loves cutting the lawn. So he comes every 2 weeks and he mows the lawn and he brings them a pizza. And that's like the sun rises and sets, because it's, he was somebody who wasn't involved, and now the spotlight is sort of on him saying, no, he is. And he's doing a really valuable thing, a really helpful thing. Local resources, what is out there? What are some of the things that you can use that we can bring on board? You may not know about some of them. A lot of times people need the benefit of a support group, and they don't know how to find those support groups, but that might be right down the street maybe it's down the street at the library or at Ethos. I mean, you may see it all the time, but it doesn't register with you. So we help you figure those things out too. Advocacy, that's my my passion is advocating for people who really maybe just don't know how to articulate the questions they have for the people who are providing the supports, including doctors. They don't know how to ask questions. They don't know that there are questions that they can ask. And I can either coach people in being able to articulate those clearly and efficiently, or I can also be the one who does that sort of intervention and reaches out to doctors and nurses and figures out what kinds of questions need to be asked. And a great example of that is, I might have somebody who has Parkinson's disease, who also has some high blood pressure, and maybe has some different medications for those illnesses along with some others. And the neurologist for his Parkinson's disease is changing the regimen of the medication he's on, which is now affecting his cardiac medication, but they're not speaking to the cardiologist and nobody's talking to the primary care. So I work very hard and I'm very passionate about making sure that there's a clean line of communication between all of the medical professionals that are involved with this particular person to make sure that medication is being taken safely and they're understanding what everybody else is prescribing. And then so that my client can also understand. And as we do that together, they learn the language and they become passionate themselves. And oftentimes they'll start picking up their phone and start doing the questions. They don't need me necessarily to do it once they learn how to themselves, but it's a big area that I focus on. Legal. A lot of times people just don't have their legal documents in order, or they want to change them, or they think they've done them one way and they realize they didn't do that. They thought they had, but they never followed through. So I don't like to get too deep into people's legal documents, but I can certainly bring in the supports and help you figure out the questions that you need to ask and make sure that it gets done in a timely fashion. And then crisis intervention. I do quite a bit of that, actually. Many of my clients are with me now because I was brought in during a crisis when, and this is really what I advocate, and I'm sure Daniel does too, is, bring a care manager on board before the crisis happens. And we can help you make those short-term and long-term goals so that when something does happen, when you have a health crisis, it's not a crisis. It's just something that needs to be managed. And, for example, many of you, I'm sure, are well aware that UTI, which in somebody my age, though really annoying and uncomfortable, I can pretty quickly identify it. I'm a nurse too, so I can do that pretty easily. But for somebody my age, it's pretty, there's typical signs and symptoms, and you see the doctor and you get it diagnosed and you go on the antibiotic. But sometimes with us as we age, we have these sort of crazy symptoms where there's confusion and there's irritability and there's odd behavior. And you may have no symptoms that are typical of UTI, but you have UTI. So sort of learning how to identify, and when that happens and nobody knows what it is, I've come into many situations that are just really complicated and things have fallen apart because of a simple UTI. So having somebody involved ahead of time and sort of figuring that stuff out is a great way to avoid a lot of terrible situations. The other thing, a lot of times, people don't have anybody in their life anymore, or they may feel like they don't. They may, and we can help you identify who those people are. But this is a typical scenario. You have somebody who's retired. She has no children, and feels all alone in the world and doesn't really know how to ask questions. And bringing on somebody like myself, I call myself a geriatric care manager. Daniel does too. The association calls us aging life care professionals. But we can come in and do a consult with you and help you identify those areas of need, and then coordinate that professional assistance. Bring you to doctor's appointments if you need to, or get you ready to go and help you determine the questions that you want to ask. And just provide that oversight and that touch point that oftentimes just knowing you have somebody makes all the difference in the world. And just really, I as Daniel said, we like to get to know who our people are. Who are you? What are you all about? You're probably very different than me, but and what you like in life might be slightly different than what I like. I'm not going to impose on you what I like. I want to know what you like so I can help you find that and get that back in your life or keep that in your life in the best way possible. So my practice, you don't need to see this one, sorry. My practice focuses on all that type of stuff. And I love working with people, so I'm happy to help.
Okay. Carolyn, thank you so much. Daniel, I just wondered if there's anything that you wanted to add to all of that.
In terms of the care management piece, no, not a lot. I mean, I kind of simplify it. It's just to add a little bit. Just that, what we do is identify the needs, and then we find the resources and the services to meet those needs. That's sort of in a nutshell in terms of what we do. And then as Carolyn gave a couple examples of her people, but as she was talking, I was just thinking of people now or people that I've helped through JP at Home, that it may be escorting people, to or from a doctor's appointment or an endoscopy, as I did with somebody at Beth Israel last week. Just to give people the idea of the services that might fall outside of home care or JP at Home for people that are considering a geriatric care manager. Because we're nurses, we can do medication pre-fills, which is something I'm doing for a lot of my people now, which is a no-touch, no-contact type of a situation, or coordinating home care beyond what they can get as a benefit of Ethos and JP at Home if they need to bring in a private care service. So it's these type of things that are a little bit different and fall outside of what the home care benefit can give them through the process of JP at Home or Ethos.
Thank you. And thank you both. We're almost ready to move into the question period of this. I'm going to share my screen once again. Carolyn, I just wanted to apologize. Your screen, we did not see your screen.
Oh, that stinks.
I'm
That's
so
terrible.
sorry. No, I'm really sorry about that. But
no, that's just so boring for people to listen to me sputter along. But
I don't think it was boring at all. I actually want to just let you know. I mean, I will be sending out the PowerPoint to everyone, so they will see those slides. And we had a couple requests for the slides. It's Sue also shared a lot of really helpful information that people want to refer to. So don't worry at all. And I think we're just kind of all learning this process of sharing, and it's it's not always perfect, but I think people understood what you're saying. So thanks again. We did have a few questions come in. I have a question for Sue. Somebody asked about whether people could use Ethos for any Medicare services, like say after surgery. When is that? I don't know the answer, so I just thought I would just ask you.
Sure, yeah. I did see that in the Q&A, and I did go ahead and enter an answer if anyone would like to see it more in writing. But the question was, sometimes people after a surgery or some sort of medical event, they'll have visiting nurse services. So someone will be coming into the home to provide nursing, physical therapy, occupational therapy, maybe speech, nutrition, home health aid for bathing and dressing and things like that. And generally that is covered by Medicare, sometimes private insurances, but often there's no cost directly to the recipient of those services. So the question was, can the home care program at Ethos be the same way? Can we bill Medicare for the services? And the answer is no. We do not bill Medicare. We do have some consumers who are on Medicaid, which in this state is called Mass Health. And so depending on which care program they're in, if they do have Medicaid, which is different from Medicare, sometimes that will be a payer source for the services. But I do also want to reiterate that even if you don't have Medicaid, you don't have Mass Health, and you are assessed a copayment for services, if the copayment is unaffordable for any reason, we can have some flexibility there because our ultimate goal is that the copayment not be a barrier to services that you are assessed as needing. So everything goes back to that assessment of need. If you're assessed as needing the services, but you can't afford the copay, we will work through that.
Okay. Thank you, Sue.
You're welcome.
That's helpful. Let's see. So I'm not sure if anybody else has any more questions. Now would be the time to chat that question. Let's see. So, and if for some reason we didn't get to your question, you can always reach out to us and get back to us about that. I'm really hoping today that you really learned something. I know that I did. I think we're really, really fortunate to have so many kind of professionals here for you with a lot of experience in the field. So I want to thank Sue and Carolyn and Daniel today, and very much. And I guess I really look forward to helping you all schedule your assessments. There is, again, the benefit of being a part is that we actually can do these quite easily at a time that's convenient to you over a platform that's convenient to you. So actually, one member actually pointed out in the chat that, just a reminder, if you've actually already had an assessment, but it was more than a year ago, you're still eligible to have an assessment each year. So it's not just a one-time thing. As part of your JP at Home membership, needs might change, and we're here to work with you again. You might want to meet Carolyn or Daniel, and we can arrange that. So just to note that once a year, it's with the geriatric care manager. After that, it may be something that I would just go over with you too. But I'm happy to do that, and also happy to just give Daniel or Carolyn's contact information if you want to get started with the private geriatric care management right away. So I want to thank everybody for coming, and really, this is really helpful. We will be posting on Band the video portion of this, and also all the PowerPoint slides. Hopefully I can send out to you in the next day or two. So thanks again. Really appreciate it, and thank you for coming today.
Thank you.
Thank you.
Bye,
Nice job. Okay. Thank you, Sue. That was great.
You're very welcome. Let me know if you need anything else.
Okay.
I'll see you later. Take care.
Bye.
Bye.
See you later.